Good day, dear guests. Good day, dear colleagues. Today we'll talk about the slowing down the aging process with peptides and other drugs. So let's begin. Modern anti-aging medicine is inconvincible without understanding the aspects of hormonal regulation, biochemistry, genetics, and molecular biology. The leading position in the anti-aging industry is occupied by cosmetology and the use of hormone replacement therapy. In second place in popularity are antioxidants for oral and injection services. The third in our rating is the use of placenta preparations. The fourth are the precursors of neurotransmitters and hypoglycemic drugs. In a separate line, we highlight the use of a complex of peptide bioregulators and homeopathic preparations. Today, we will talk mainly about peptides and their role in the anti-aging medicine. There are many peptides, but for us, of interest first of all are the bioregulators of the work of various organs and systems. They were singled out in a separate class, studied and tested, and subsequently drugs and pharmaceuticals were developed on their basis. Bioregulators are fragments of utilized proteins, and they perform special signaling functions. They complementary interact with the starting sites of gene reading, triggering protein resynthesis in the cell, the one of which they are fragments. This is a highly effective mechanism of self-regulation of cells. Bioregulators are characterized by targeted action, so we always talk about a group of or complex of drugs. Peptides have no toxic, no mutagenic, or carcinogenic effects. They can be used by your preferences to maintain the quality of work of certain systems and, of course, for the prevention of accelerated aging. There are many schemes and protocols for the prevention of aging using peptides. In the classics, it is customary to work primarily with the neuroendocrine and immune systems in combination with the brain and the vascular wall. Then it is time to work with the rest of the organs. But today we'll move away from classical representations since they do not always work, unfortunately. It should be understood that the acceleration of the aging process is based on stress adaptation disorders, intoxication, and immune disorders. Following this, the rate of tissue renewal and the work of the reproductive system fail. A deficiency of neurotransmitters develops against the background of widespread peptide deficiency and mitochondrial dysfunction. Degradation of all types of tissues develops. And all these processes are accelerated by glycation, which amplifies mitochondrial dysfunction, intoxication, and damaging receptors, enzymes, proteins, and peptides. Glycation leads to damage and inflammation in the vascular wall in atherosclerosis and so on. Only in this way, understanding the complexity of the aging process and all the breakdowns in this huge machinery, can one think professionally and creatively. Injections of antioxidants and the same glutathione in combination with placenta preparations give a phenomenal but temporary effect. In addition, you may not fully know what is contained in these placental preparations and what processes they launch and stimulate. Therefore, a thorough examination of patients is required before using placental practices, excluding any kind of risk. Peptide drugs are in the winning position due to the lack of them. You can use extracts of organs and tissues or their synthesized analogs. Peptides can physiologically correct hormone levels in some cases. Peptides do not have a withdrawal syndrome and a huge list of contraindications. These are the elements of food, but they are highly concentrated since the usual diet does not cover the body's requirements for signaling molecules in case of age-related changes and advanced distress syndrome. And sometimes it seems that you can take a manual using a complex of peptides and solve many age-related problems. Yes, you can, sure. But more and more often, we face the fact that it is impossible to solve the problem of classically early aging of the reproductive system. Although 5 years ago we talked about success in this area. So what's the deal? And why? Every time we need a more subtle approach to patients with advanced distress syndrome. Because despite all the lab results that speak of adrenal tide syndrome, adrenal medications don't seem to work. We fight with insulin resistance and cope with it, and the level of hormones remains still the same. Why? But one has only to carry out infusion detox therapy and apply certain methods of correcting the work of epiphysis, hypothalamus, and pituitary gland. The level of sex hormones and other indicators become desirable. Why? Why is that? It's simple. Because the problem initially lies in the disruption of the mitochondria, in the interruption of the epiphysis and hypothalamus, and of course, in the liver disorders. Therefore, today we will give our modern vision of preventing premature aging. So, what should be taken into service? The first, patients should use a complex of assets for a long time to correct the state of the body and mitochondria. These are certain dosages of glycine, acetylcysteine, carnitine, magnesium, myoinositol, thionic acid, vitamins D3 and K2, and citrulline. Arginine requires a separate period of monotherapy and is not used in combination with anything. It's important. As well as coenzyme Q10. By the way, the latter in the form of ubiquinone is not suitable for everyone, so the ubiquinol form is preferable. This is all the so-called base for taking during 16 weeks since mitochondria begin to emerge from a crisis state only after 8 weeks effectively. Against the background on this therapy, at the very beginning, it makes sense and justification to conduct a course of several infusions of glutathione to significantly reduce the intoxication and facilitate the work of the liver. Next comes a time for peptides and other pharmaceuticals. So we put the endolutein, a peptide preparation of the pineal gland, at the forefront. It should be used in 1 capsule in the morning, 1 time in 3 days for 4 months. This is the most optimal rhythm for bringing the neuroendocrine and immune system to a physiological level. Anti-lutein restores the level and cyclicity of the synthesis of serotonin and melatonin, regulates the work of the adrenal glands and immune and reproductive systems. Anti-lutein has an activating effect on the second phase of detoxification, activating the system of glutathione catalase and superoxide dismutase through melatonin. And of course, the peptide preparation of the pineal gland reduces the level of insulin resistance, which also have a positive effect on the state of the vessels and the level of free sex hormones. The pineal gland peptide has direct telomerase activity, restoring the length of telomeres by the physiological norm. And also, the pineal gland peptide reduces the incidence of spontaneous and induced tumors several times. It also called the gold standard of longevity. So what else can be included in the scheme for overcoming distress syndrome and preventing accelerated aging? Liver peptide preparation, or again, or Slerinorm, to accelerate detoxification processes. They should be connected 2 weeks after the start of therapy. Duration of admission is 1 month. For the same purpose and in the same period, we add the antioxidant drug complex 3D with superoxide dismutase catalase, dihydroquercetin, and glutathione precursors. Duration of admission is 2 months. Starting from the 6th week, we can use preparations of the vascular wall, Vasogen or Ventford, and the preparations for the brain, Pinolon or Ceruletan. Duration of admission is 1 month. And only after 12 weeks we add preparations for gender profile. Testolutein for men or Genalutein for women. And the preparations for cartilaginous tissue, cartilax or sigmoid. The duration of their use is 1 month. And remember that earlier the focus was on using a group of peptide drugs simultaneously without any detox therapy and correcting mitochondrial functions. No preference was given to monotherapy with the epiphysis peptide combined with detox and the gradual introduction of other peptide drugs. Well, since we paid special attention to the glycation process as a universal tissue degradation amplifier, there is a direct need to prescribe our complex anti-glycation drug called Revilab anti-AGE from the first day of therapy. And this is the most optimal tactic for bringing the body out of an uncontrollable crisis and significantly slowing down the aging process. So what can I say as a conclusion? The modern anti-aging medicine is unthinkable without using modern highly effective and safe peptide bioregulators. The use of various methods for the prevention of premature aging requires a clear justification and systematization. Today, it is preferable to combine the correction of mitochondrial functions, anti-glycation, detox therapy, and long-term administration of a pineal gland peptide as a monodrug. All the other peptide bioregulators should be included in the therapy protocols with a significant delay and in stages. This is it, and thank you for your attention.